Thank you, Malcolm. That really helps us start to see how we can do our work today. We're being called upon to move from these broad concepts to very specific activities. And our next panel will help us do that. And we're going to look now at a framework for this change. How can we pull these things together and actually create an educational program for the future? So I'd like to call up as moderator James Fox from the Association of the American Veterinary Medical Colleges and his team, Chris Olsen from the University of Wisconsin-Madison, and Laura Kahn, co-founder of the One Health Initiative, to tell us about this as a framework for healthcare.
Where's forward? This one. Yeah, right. Yes. Come up for you. Okay. Our other speaker is Rita Colwell. Where's Rita? There you are, Rita. Good to see you. Please, would you come forward? Many of us in the audience are very appreciative of the panel that we put together this morning to talk about an issue that I'm very committed to and have been for the last several years. And this is based on a long-held belief, first echoed by Rudolf Virchow, and saying that between animal and human medicine there is no dividing line, nor should there be. The object is different, but the experience obtained constitutes the basis of all medicine. And this really is the framework of the One Health concept, with the addition of the importance, as we realize, of the environment that we live in and how that intersects with animal health and human health. The concept, therefore, of One Health unites the entire spectrum of the medical experience with the goal of improving and protecting the health of all animals, all other animals in our environment worldwide. So we live in a complicated world, as we all appreciate, a shrinking world in which we're exposed to many different onslaughts in our daily lives. And this is combined with a changing environment, the fact that our population is increasingly vulnerable to different insults, and we have a plethora of different animal species which are carriers of human pathogens that can wreak havoc in terms of disease burden. So this convergence model is based on the fact that we have this perfect storm, so to speak, in terms of physical and environmental factors, genetic and biological factors which influences outcome of disease. As I mentioned, we have wildlife vectors and also insults to wildlife because of encroaching population demands. And again, as we all appreciate, we have social, political, and economic factors which drives this perfect storm and has its impact on ecological factors in our world as well as human health. So those of us in the veterinary field realize how important diseases transmitted from animals to humans are, and indeed these various pathogens constitute 60% of all known infectious organisms in man, and indeed they consist of 75% of emerging pathogens. And if one looks in the literature today, it's replete with the importance of climate change and infectious disease and how these two interface and are impacting our various ecosystems and effect on disease presentation, not only in humans, but as indicated in this paper in Science, how it's impacting various species of animals and impacting their survival in our various hemispheres. The other thing that's not readily appreciated, certainly in our society today, is the fact that in 2050, we'll have 9 billion individuals in the world. And so the point of food supply and food security is increasingly important. And how are we going to deal with this? This very interesting article in Science illustrates the point that in certain populations, in this case in Asia, that 6% of the annual rice harvest, or roughly enough to feed Indonesia's 240 million people for a year, is ingested by rats. And this is an example of how the intricate balance of our food production supply chain is so important and will be particularly increasingly important as the years go by. And you can see in this slide about the graphically illustrating these brown swaths indicating the extent of rodent damage in rice terraces in the Philippines. Indeed impressive. So what are some of these emerging infections? You can just look at this global map, and certainly we all in the audience appreciate the recent Ebola outbreak in Africa, but there are many more emerging pathogens that we have to be concerned about. And again, it's because of this complex eco-environment that we have in encroaching upon native habitats and exposure to particular different species of bats which carry these organisms. And this is going to become an increasingly important global problem. So what are we doing in today's world about addressing the whole concept of One Health? There's various organizations that are dealing with the One Health concept. I bring to your attention the One Health Commission, which is indeed represented by many of the organizations in this room, in which they are looking at various issues, educational, informative programs, informing the public and the government, and indeed academia about the importance of the One Health initiative. And I urge you to look at their website and again, to be reminded that individuals can join this One Health Commission and lend their voice and their enthusiasm for this concept. Indeed, we have now a new publication called the One Health Journal, and again embraces the concepts that I've been mentioning to you for the last several minutes. And I would urge you to consider, if you have appropriate information, research on this subject, that you look at this journal for possible submission. And again, as illustrated, One Health is all connected. Again, there are international conferences, national conferences that are being held. We have an International One Health Congress organized on a biennial basis, and the fourth will be held in Melbourne, Australia in December of 2016. So again, this is a global initiative. It's not localized, but it is global, and increasing awareness of this program is taking place. So I'd like to specifically point out an initiative of the American Veterinary Medical Colleges, which I'm a representative for, of a new project which they've just launched, the One Health Case Studies. And this is in collaboration with other organizations, and it seeks to integrate One Health concepts into degree programs of health professional students through case study method of instruction. And I'm happy to know that my colleagues from the AAVMC are here today and will be anxious to answer questions about this new initiative. And again, it's for a broad-based approach on One Health across interdisciplines that would accomplish the concepts that I've been discussing this morning. So in summary, before we turn this over to our esteemed speakers this morning, we want to recognize the linkages in health across the professions. It advocates proactive multidisciplinary approaches, encourages collaborations across old boundaries, again, breaking down those walls, pursues enhanced educational programs, and envisions local, national, and global impacts. So with that short introduction, I'm going to turn the podium over to my colleague, Chris Olsen, and he will be presenting a short presentation that illustrates the power and the importance of the One Health concept. Chris?